A 3% pay rise. What does that actually mean across the board for general practice and for the NHS health services? And how viable is it? We're going to cover that in this episode as we talk about the new 3% suggested pay rise for NHS staff and what that means for general practice, partners, and pretty much everybody else. Let's take enhance your primary care and learning. Hey, GP Learner, you've got me, Dr. Gandalf, and we've got Andy as usual talking about the 3% pay rise across the board in the NHS for healthcare staff. Well, sort of. What do you think, Andy?
Yeah, it's interesting. I think there's a little bit more to this when it comes to general practice, because general practice is different to the other parts of the NHS, as we're all aware, and hopefully the viewers are aware. But just in case you're not, GP practices generally are small and medium-sized businesses. They hold their own budget and they manage their own finances, and they make their own sort of funding, purchasing, and pay decisions at the end of the day. And they are partnerships run by GP partners for the most part, and those partners aren't paid a salary. Mm-hmm. They are paid a share of what is called profit. I'm never sure if that's the right word, because it sort of smacks of profiteering, doesn't it? But they are paid from what is left over after everything else has been paid for. So in effect, sometimes use the word profit, but we always talk about being paid last, basically. And if something has gone wrong elsewhere or costs haven't been controlled or there's been something unforeseen, then we get paid less than we expect, because we are holding the business risk for the practice. So very different to the situation that hospital consultants and doctors and other elements of the salaried GP workforce find themselves in. So this may mean something different for us. I'm very keen to get your impressions and explore and unpick this topic.
Yeah, absolutely agree, Andy. And I guess the other part to be aware of, that general practices, as we talk about in terms of small to medium-sized businesses, can't be limited liability companies, etc., like most other businesses tend to be. So in terms of that risk of the financial viability of the practice, that is completely borne by the partners themselves. So as you said, if they don't make any surplus or profit or whatever you want to call it, then they end up paying for it, and they can't, like many other businesses often do that you hear about, declare themselves as bankrupt, and actually financially they've not been a risk, apart from obviously the staff that may obviously been out of a job and stuff if that was to happen. But I guess the key reason why we're raising this is a couple of days ago it was announced that the DDRB, so I forgot what exactly it stands for, the Doctors and Dentists Review Board, that basically decides how much of an uplift NHS staff in particular should receive, was confirmed by the government. So normally they make a recommendation to the government of the pay increases or changes that should happen to various parts of the NHS staff, and then the government decides what they give. Back in March, they initially indicated they were only going to give a 1% pay rise, despite all the amazing work that the NHS has done over the COVID pandemic and everything else. But as of a couple of days ago, they've changed that to agree to the DDRB recommendation, which was 3%. So that is for things like nurses, that is for paramedics, that is for other members of staff, but specifically general practice, that's going to be your practice nurses, your admin teams, and your salaried GPs. That will not be for the GP partners, because it's the practices that have to pay this, not the NHS, shall we say. So that's the situation, Andy. Is that your interpretation of it?
Yeah, I think that's the situation. I think it's going to be interesting if we just pick a little bit at this to see what it might mean for GP practices, and then particularly, I suppose, both sat here as GP partners, for GP partners, because we need to unpick the business implications of this. And I'm sure we'll have to get our spreadsheet and our calculators out and go even deeper than we're going to do in this episode to really work out the implications. But yeah, so I mean, the initial reaction, Gandhi, just in general for the NHS workforce, 3% within the current pandemic context. What's, putting general practice to one side, what's your general reaction to the 3% figure?
Bit of a smack in the teeth. That would be my view. So obviously over the past 18 months, the NHS and the healthcare service as a whole has basically stepped up and rapidly and significantly changed the way it does things to try and keep as many patients safe. We, on top of that, have obviously delivered a world-beating vaccination program to the population to make sure that the England can and the UK itself can be as operational as quickly as possible. And we've tried to do our utmost best, despite several decisions made by our government to keep the population safe and things. And for that, the reward that they are then having is a 3% increase in pay, which is not even in line with inflation over the past couple of years and stuff. So, yeah, Doesn't taste very nice, does it, Andy?
Yeah, I think I was hoping to see a bigger figure. I'm going to be devil's advocate slightly and just say, well, but we're also looking at a situation where a number of people's healthcare work has been really, really challenging, and people have sacrificed an awful lot over the last year. So, I mean, we have to absolutely acknowledge that. There are other sectors that are just beginning to come out of lockdown, where the outlook for those jobs is really, really, really uncertain, and it's really unclear what's going to happen. So some elements of the country may look at a 3% pay rise in what is considered a sort of relatively secure industry. Come rain or shine economically, healthcare jobs are traditionally fairly secure. People in other industries may be looking, thinking, actually, I wish I had a guaranteed job and a 3% pay rise when they're looking at redundancy. So just sort of providing a little bit of balance there. That being said, it's 3% after a horrible time in the pandemic, and that's on the back of years of underfunding and struggling to recruit sufficient numbers of doctors, nurses, healthcare professionals, carers, and so forth. This doesn't even talk about carers, actually, and people who work in care homes and social care. And I think if anything, if we get 3%, they deserve more than that, because for many of them, their starting point is lower than it is for many of us who work in the NHS. So yeah, I think it's complicated. I would like to have seen more. I'm glad that it's more than 1%, which was what was suggested previously, and it's in the context of quite constrained government finances. So I don't know. I don't really know what to think. I'm just thinking meh, really, to it. To be honest. Yeah. So shall we start to pick apart a little bit? In terms of...
Sure. So I know you wanted to share, obviously, some documents. In particular, we've got this article by Pulse that talks about the salary GP pay rise and how it feels like an empty promise because it's not got any attached funding. I guess this is the key thing. The government has said that 3% should be given to these members of staff, but it hasn't made any direct provision for that 3% to come from the various organisations that would have to pay that 3%. There's not been a designated uplift that satisfies that increase, shall we say, at the same time.
However, so earlier in the year, as part of the sort of agreed, I think 5-year rolling sort of funding for general practice agreement between the Department of Health and BMA GPC committee, there is actually, and I had to look back and just sort of remember what this document said, because there was a lot going on earlier in the year when this came out. But actually, there was already some reasonable, I use the word reasonable, increases to the main ways that general practice gets funded. So in terms of the global sum, the amount that we get paid per patient per year, £96. Try and insure your hamster for that, we always say. That's for general practice to do what it does to provide healthcare. And also QOF, another place where we get a lot of our funding from, similarly a 3-ish% increase in that, and then out of hours, similar adjustment for the provision that passes to out of hours providers as well. So some people are saying, actually, you were already getting a 3% increase in your global sum, your main types of income. So it's already covered. What say you to that?
Well, I guess a couple of the parts to pick from that. So yes, there has been an increase. That increase was based on previous negotiations that happened several years ago as part of the PCN-DES. And haven't taken into account significant changes I think the entire healthcare service, and particularly general practice, has undergone over the past year and a half. I think the other part as well, that negotiation was also more recently predicated on a 1% increase for staff, which was originally the government's intention. So therefore, actually, does that encompass the increases that would then happen? Probably not, when you count up all the other kind of things that general practice is being asked to do with that increase in funding, because it's not just here's the money off, you go and keep doing what you're doing. Now on top of that, we also have to do all the various different parts of the PCN-DES, which yes, there's some separate funding for that, but there is additional work that's come through, additional monitoring requirements, the significant change cycle that's happened in general practice that is being funded apparently by this small increase and stuff. And in addition, the expansion to make sure that we are still coping for the needs of the population. And let's remember, and this is one of the key things I think many people have a problem with, the capitation that we get, that £97 that Andy showed us, that is unlimited access to your general practitioner and to the practice itself. So you can go 100 times in a year, and I have patients that do this, that come to the practice 100 times a year, or you go once a year. Yes, the practice gets exactly the same amount, but they have to make sure they have the capacity to try and cope with that. And that is one of the reasons why it's so difficult at times to get a GP appointment from perception. Although obviously contact with your practice is a separate thing and absolutely a lot easier than people think it is. At the very least it is in ours, because we know that many of our patients have contact with us on a regular basis. That's how it's funded. That's where the funding comes from and stuff, but it's also why the 3% increase is a bit of a challenge, because increasing the wage bill, which is probably the largest expense for most practices outside of possibly estates, by 3% when your income has gone up by probably a similar amount, but at the same time the amount of work you're being asked to do has done this as well, doesn't balance, and therefore where is that money actually coming from? And more importantly, for those that are then having to have their livelihood based on what's left over, it's going the wrong way, unfortunately. And I don't know about you, Andy, but my pay, unfortunately, year on year is actually going down rather than even staying the same.
Yeah, that's been my experience over the last 10 years of being a GP partner, actually, is that the amount of money that you take home has actually stood either completely still or gone down a bit over 10 years.
Yeah, our workload is doing that.
The workload has increased, and the inflation, and there's just been general inflation as well. You know, what was a pound in 2011? You know, you can't buy for a pound anymore in 2021. So I think GP partners have become poorer over that time period, or that's my experience of it. And it's difficult when you need to recruit GP partners to sustain the whole general practice sector.
Absolutely. And just before we get any of those right-wing comments that come in and say, well, there's doctors out there that earn 150,000, 200,000, £1 million, or whatever the crazy number the Daily Mail comes up with at this point, let's be clear, there's an exceptionally small proportion of GP partners that's often down to external factors, like they own the companies that actually hire GPs. That is not your average GP. I can guarantee you. Well, I don't know about Andy, but I definitely do not earn anywhere near those levels of finance and stuff, despite working about 70 hours a week at the moment.
Yeah, ditto over here. And I was just going to highlight, actually, remember this is within the context of increasing pressure to increase capacity, to meet the demands of patients. We mustn't forget that pre-pandemic, the sorts of conversations we were having were about patients living longer with more medical conditions, more complex medical conditions, more availability of treatment to keep them alive longer. They require more input, more monitoring, more consultations per year. And on the other side, there's actually a sort of a consumer-led consumerization attitude towards general practice, meaning that people generally expect more and quicker access from the GPs. And we see that consultation rates with GPs and the number of consultations provided are going up. And if those demands are to be met, then there is a basic increase in funding for the sector that needs to that needs to happen. So yeah, I think it's difficult if practices were budgeting based on the figures of a 3% increase in most of its income streams, 1% increase in wage bill, looking to meet some of the increased demands and expectations placed on them by government and patients, to now be faced with a significant change in that plan and increasing the wage bill, I think is difficult for those people who are planning how to deliver services at general practice. I think we will find that services will not improve and expand in the way that was hoped. And I think we'll see that GP partners, and it's difficult because nobody will be playing their little violins for us. It never happens. I won't hold my breath, but I think income will again sort of stagnate or go down a little bit. And whilst I'm not really looking for sympathy, but I think it is an issue for everybody, because the system does need GP partners, and people are stopping being partners regularly. The numbers of partners are going down. So you're looking at a bit of a crisis in the sector. If people actually still want any access to their GP surgeries or decent access, then it needs to be palatable to be a GP partner, or the whole system will not work. So there's a sustainability issue that I think the public and the government should be interested in. They're not necessarily going to be interested in how much GPs get paid, but the sustainability of the sector should be of interest to them.
Absolutely agree. I think there's significant challenges. I know there will be some practices out there that, if they were to give the 3% increase, which actually I think a lot of practices want to give their staff an increase. Let's be clear, our staff have been absolutely amazing. They worked dedicatedly under really difficult circumstances over the past year and a half, and to reward them financially for the work they're doing is absolute priority and an important part of it. However, making sure the business continues to be viable as a result of that is often a challenge, and that's a challenge every business has, let's be honest with that point. But the key thing is, if you are working in a situation where, and I know this is going to happen in some practices, where the salaried doctors, those clinicians that are paid to work there as employees, are actually earning more than the business owners, that creates inequality, particularly if the workload is completely different. And that then creates more frustrations. And like you say, the more likelihood that those partners will say, I've had enough, I can't deal with this, I'm off. And the reason why general practice, in my personal view, is the most efficient form of healthcare delivery, part of the healthcare system itself, is because of the partnership model. It's the reason why it is so cheap. Let's be honest, general practice delivers 90% of the patient contacts in the NHS for less than 10% of that budget. That's what 13.4 billion the entire general practice gets paid roughly. If you go off the fact the NHS budget is 134 billion. Compare that to test and trace, they've got 37 billion, and let's be honest, how effective was that? Well, we're in the middle of Pingate, so you tell me. But those are the comparative differences we are dealing with, and yet the entire general practice is funded for almost a third of what test and trace has had resource for in the past year. Imagine how amazing general practice would be if it had that level of funding. Just imagine it for a second. And that's what we're dealing with. But hey, I'm ranting. I apologize, Andy. I know it's sometimes gone that low.
No. I could rant as well. Where's the workforce, Gandhi? Even if you had the money, where would you find all of these people? It takes 5 years. It takes 10 years to 7 years to train a GP. 8. So
you get much better retention of the existing workforce. That's where the workforce would come from. Because actually, if you adequately resource general practice to say that it can cover the workload that comes through, I suspect that the workforce that has increasingly been saying they're not going to work full time because it's too difficult, because it's too pressured, because it's too challenging, will then start to say, actually, I can come back because I've got more resources to make sure that the practice can function effectively. But yeah, it is there. It's just convincing them to come back.
That's true. So Gandhi, I'm going to ask you to. I want you to give me a figure, and this has to be. Actually, I'm going to fact check you first, because I don't think the inflation rate's been above 3% for the last few years. I think we've had historic low inflation just before other people come in and fact check us. But still, inflation now, I think, is above the Bank of England's 2% target, and many expect it to go higher. So I think there is a cost pressure on the sorts of things that GP practice have to purchase in, as well as wage costs. But I was going to ask you a question. So what should the figure be for the NHS? If you were to suggest a realistic figure for the NHS pay rise this year, I've been talking, hospital doctors as well, just the headline figure. What should it be?
I'll be honest, I don't know, because you're right. We are balancing that against other parts of the industries where people have lost their jobs, where people are not able to work, where, there's been other challenges. I'll be honest, I couldn't give you a figure, and I don't know what the figure is, and I'm the wrong person to ask what the figure is, because if you're going to ask me, what kind of pay rise should you give me? I'd ask for 100%, but then I'm realistic. I'm not going to have that. I'm not going to take that. I'm not going to get that. But I think what needs to be understood is the funding model that sits behind all of this, and that it needs to be equitable and sustainable. That's the key thing. These comments are just media pundits, they're optics for the government to say, yay, we've given the NHS more money, but actually they haven't. Let's be clear on that point. They haven't given general practice more money. They've, they haven't given GPs, salaried GPs, they haven't given nurses more money. They've just told the organisations that pay them to pay them more money, but we're not going to give you the money to do that. So you're going to have to make cuts elsewhere. And that will mean changes in services to patients. And that's what they never talk about in these kind of optics and stuff. So, yeah.
There we go. Yeah. I think I'd not answer the question directly, and would ask for concrete pledges about in genuine sort of investment in health and social care, with a real credible plan that stretches out a few years into the future and doesn't change every 5 minutes. So some real investment, and I think that does involving increased investment in the workforce and enhancing pay. But I'd like to look at what's required to retain the right people with the right
Agree.
skills in the right places, in the right areas. And I'm not always sure about headline pay increases in general, to be honest. I think it's important that we know, because we need to know if it's too low. But the same pay rise for everybody everywhere in the country, I don't know if that's the right approach. But anyway, there we go. It was fun unpicking that topic, and I think there was a little bit more to it than the headline. So that was a fun episode for me.
Cool. So if you've got any comments or questions, UPC learners, let us know. We're more than happy to hear your comments. If you think we're talking complete poppycock and stuff, then let us know. If you agree with us, again, absolutely let us know. Give us a like if you found this useful content and stuff, because it lets us know that this is useful. And as always, EGP Learning is here to help tech enhance your primary care and learning. We will catch you in the next episode.